Hi, my name is Jabria Hill, and today I'm going to be doing a video over parasomnias. So parasomnias are a physical movement or action that occurs during sleep that is unwanted. There are several types of parasomnias, and some of the parasomnias that I'm going to be talking about today include sleepwalking. So sleepwalking is when you are asleep, but your body is moving. Like you will sit up in bed, or you might get up and actually start walking, or you might jump up and run out of your bed. There's also confusional arousal, and a confusional arousal is when you're asleep and you wake up and confused. It is exactly how it sounds. You'll be confused about who you are, you'll be confused about where you are, and you may have some slurred speech as well. And you also have night terrors. And night terrors is when you wake up with a feeling of fear. And when you wake up with this feeling of fear, it may be followed by a loud scream or a loud cry. There's also recurrent isolated sleep paralysis. And this is when you have the inability to move during sleep onset. So in order for you to be diagnosed with recurrent isolated sleep paralysis, you would first need to be tested for narcolepsy. And once you're tested for narcolepsy and narcolepsy is ruled out, then you'll be able to be diagnosed with recurrent isolated sleep paralysis. There's also nightmare disorder, and this is when you are waking up out of your sleep due to an intense scream. And this causes people get confused with nightmare disorder and nightmare terrors. There are two totally different things. Like I said, the night terrors is when you wake up with feeling of fear or a loud scream, and a nightmare disorder is when you wake up out of your dream because you've had a bad nightmare. There's also sleep related eating disorder, and this is when you are asleep but you wake up, you're not aware that you're awake, and you go into your refrigerator or your kitchen, wherever there is food, and you just start eating. You're still asleep, you don't know that you're eating, you don't know that you're walking, that you're up and everything, and you just eat. And it's most commonly people that have this disorder, they usually eat junk food. So when they wake up in the morning, they're probably just feeling full and just not feeling well. And then they look around, or they get up and they're wondering why there's so much crumbs in their bed, or why there's crumbs in the kitchen or food everywhere. Is because they have sleep-related eating disorder and they're not aware of it, that they have been eating all night. And they may think that it's rats or maybe another family member that's doing it, when in reality it's really them that's doing it. And another parasomnia is sleep enuresis, and this is bedwetting. So to diagnose parasomnias, you will need to go and see your physician. Your physician will probably send you to a sleep tech for further examination. And when diagnosing parasomnias, they'll look at a review of your medical history, your sleep history, and your PSG study. There are also certain things that trigger parasomnias, and this includes stress, anxiety, depression, PTSD, which is post-traumatic stress disorder, substance use or abuse, certain medications, an irregular sleep schedule, and sleep deprivation. There are treatments for parasomnia. The treatment depends on the type of parasomnia and also the severity of parasomnia. So you can be treated with medication. So you can be treated with antidepressants, melatonin, or dopamine agonists. And then there's cognitive behavioral therapy, which is things like psychotherapy, relaxation therapy, or hypnosis. And then there's also home treatment, such as scheduled awakings. And scheduled awakings is when you wake up maybe 15 or 30 minutes before you're supposed to wake up, just to help yourself be more awake. And then there is things you can do, such as make sure you have a safer environment, especially for people who have RBD, which is REM behavior disorder, which is also a parasomnia. So you want to do things such as get rid of any harmful objects that are in your room or your sleeping area, or lock your doors or lock your windows, or sleep with extra padding, or even sleep on the floor, just to help you stay safe. That is all I have for you. I did not go over all the parasomnias, but I went over some of the parasomnias. I hope that this video helps you understand parasomnias a little bit more, or help you to diagnose, well, not diagnose yourself, but if you're having any of the symptoms, it'll help you in wanting to go see your doctor so that you can get help to fix the parasomnia.